you guys can go ahead and do that pre-quiz for me. Just write either pre or one on the Scantron so I know that it's the pre-quiz. You do not have to write your name if you don't want to, unless you're dying to know what grade you get. It's just so I can know what your baseline knowledge is. Oh, hadn't gotten there yet. And don't write on the quiz, please, because we're going to do a post-quiz and we're going to use the same quiz.
Okay, so she's an educator student, so she's doing some of the things that's required for her class as well. So she wants to do a pre and post quiz for you guys, with you guys.
Yes, don't stress about it. It's just
Don't stress about it.
on the top of our skin, try write free. Just write free. That's all you need to do.
Anybody else need a Scantron?
My name is Amber Ellison. I'm a nurse at Emmett Health. I've already put that.
Oh, okay.
I'm a nurse at Emmett Health Emergency Medical. Emmett Health Medical Center in the emergency room. I think I've seen you
Yeah,
before.
I've seen you a lot.
I've been there for almost 9 years. Like the first 6 months I was a tech, and then the rest of that as a nurse. So that's the only place I've ever done my nursing, and I love it. Today we're going to talk about the Patient Protection and Affordable Care Act, which is also known as PPAC, ACA, or PPACA or ACA. So I'll just say ACA for the most part. So the objectives for today's class. Why do we need reform? What the PPACA is, why is it important for nurses, and then the recommendations from the Institute of Medicine. So why do we need reform, guys?
A lot of people can't receive care that they need.
Very good. Anybody else?
Think about the movie.
We spend a lot of money but don't have good health.
Yes, we spend a ton of money. A 2009 study found that in all of bankruptcies in that year, 62% of the bankruptcies were related to medical expenditures, and 75% of those people that filed for bankruptcy had health care when they filed for bankruptcy. Our gross domestic product is 16% health care. We spent $2.8 trillion in 2013. And in my readings, I'm doing a healthcare policy class as well, and I found this statistic to be just staggering. The last statistic up there, accounting for age, sex, poor initial health status, education, and smoking, you had a risk of dying 25% more if you did not have insurance. That's just staggering to me. The goals of the reform is containing costs, promoting health, preventing disease, increase the workforce, to make sure that we have access to health care, and to reform the insurance industry. Now, I know that the PPAC is it's a hot topic right now. There's a lot of people that are for it, there's a lot of people that are against it. This class is not about those emotions that people have. This class is just to give you information. So please, I understand that some people will get very upset about this topic, and I just want to give you information. I don't want to sway you one way or the other. I just want you to, I knew nothing about this when I started this. And learning about it, like teaching it, is the best way to learn about it, because I have learned so much. So, a video. This is a little YouTube video about the PPAC, and it was made in 2010, so it's not quite like, I think there's a little comment about the states expanding Medicaid, and we all know that the Supreme Court ruled that the states have the choice to expand Medicaid, so it's not like not all states are going to expand. Small businesses, by small, less than 25 employees, begin to get a tax credit. If you were a hospital that was nonprofit, you started to be required to do a community assessment. And if you didn't do the community assessment, you had a $50,000 a year failure. This website right here will actually take you to the community assessment that AMED did. And so if you want to go over it, if you want to see it, how do you make this thing scroll? Oh, there it is. So if you see on the paper or on the page, it talks about the research, the community it served, the findings, all that good stuff. And it's pretty long, so if you want to see it, there it is, if you want to go to it. As the video talked about, your pre-existing coverage ended. So they could cover children that had pre-existing conditions like asthma, seizures, all sorts of stuff, cystic fibrosis. They did a creation of a National Prevention, Health Promotion, and Public Health Council, and what they do is they develop national prevention, health promotion, and public health strategies, hence the name. Developed the internet website, which is healthcare.gov, the indoor tanning tax, which is 10%, and it extends coverage to children 26 years of age, regardless of whether or not they are in school. All right, sorry about that. So all of your old plans have been grandfathered in, so they don't have to have this, but any new plan needs to have an appeals process in place so that if you feel that you've been charged too much, you can appeal it. The National Healthcare Workforce Commission was established, and it coordinates the federal workforce alternates and makes any recommendations. Now, I'm going to read this one because if I don't, I'll mess it up. Comparative Effectiveness Research, which was established as a nonprofit patient-centered outcomes research institute, which conducts research that compares the clinical effectiveness of medical treatments. Because I will mess it up if I don't read it. But basically, it's an institute, and they make sure that there's effective medical treatment and try to implement anything that needs to be implemented. So, and then increased funding for prevention of public health, $5 billion per year between 2010 and 2014, and then after that, $2 billion per year, which I know sounds like a lot of money, but the defense budget for this year is $495 billion, so it's really not that much. Care beneficiary drug rebate of $250 for those who reach the donut hole, and I gave you an article, we're going to read that in just a few minutes. But the donut hole is basically a coverage gap in Medicare. You pay like $310, I think, out of pocket, and then Medicare starts kicking in to $2,500 maybe, and then when you reach $2,500 of out-of-pocket expenses, they stop paying again, and then you have like $2,000 of out-of-pocket expenses that you have to pay, and that's called the donut hole. Expand to childless adults, 133% of the poverty level. And Ms. Webster was saying that the largest Medicaid group right now is your young white men. It was supposed to start in 2011, but it hasn't started yet. Your teaching health centers, which Sullivan Center is an example. And your graduate medical education, which increases graduate medical education by redistributing currently unused slots and helps to promote it. That's two big things that it did in 2011. There's teaching health centers. The Sullivan Center has been around since like the 1970s, so Clemson's actually ahead of the ACA. But there's teaching health centers sprouting up all over America because of this, and they're using the graduate medical education as well to help staff it. Funding for health insurance exchange. Medicaid, there's a frame in the, like ahead that talks about Medicare decreasing the amount, but Medicaid will no longer reimburse for hospital-acquired infections. So like if you get a COTI, which is an infection from a Foley catheter, Medicaid won't pay for it. Medicare Independent Payment Advisory Board, which is that board that was created to, if Medicaid doesn't, if they spend too much money, it's a board that's created to help, like, see why they spent so much money and to make proposals is to hopefully decrease how much money they spend in the future. I'm scared to do this again. This is the article about the donut hole that I gave you guys. If you guys want to look it over real quick and read it, it just tells you about the donut hole. It's a little activity, pair, compare, and ask. So if you'll just get in groups of, I mean, you can either get in groups of 2 or 3, or you can stay at your table and you don't have to go anywhere else. But you can compare your lecture notes, fill in any information that you may have missed, and if you have any questions. Well, then you would have to go to healthcare.gov and check out the different plans.
Like, what if he doesn't?
If he doesn't, the individual mandate has gone into effect, and so he'll have to pay, it's like 1%. This year, it's 1% of your income if you make more than $10,000. If you make less than $10,000, there is no individual mandate. And the maximum for an individual is $95. The maximum for a family is $285.
So like a homeless person wouldn't have to pay it,
No.
but then they're gonna be the number one person probably going to the law.
Yeah, exactly. Also, like, well, and with these health centers that are popping up, hopefully the homeless people will be able to go to them and use them instead of the emergency room, because the emergency room is a black hole of money, as we all know. So, do you guys understand why it's important for nurses to know how much prescriptions cost? You guys understand that? You want to explain that?
Well, if you have a patient and you know the doctor, sometimes the doctors are really good at knowing different pharmacies that, like Publix, for instance, has certain free antibiotics. So certain physicians will know that and they'll tell them to go there. But if the physician doesn't know, it's really important for the nurse, because maybe they can catch it before the patient leaves and say, hey, you know, what can you write a generic for this? Or this medicine is cheaper at this pharmacy. Could you maybe, instead of sending the patient out, them get into the pharmacy, realizing it's really expensive, then them calling back to the office, or if it's in the emergency department, I mean, it could take even longer. But just help the patients out. So
Exactly.
that they don't with
Publix also has free amlodipine, free lisinopril, and free metformin. So 2 free blood pressures, 1 free sugar. And then, of course, Walmart has a ton of $4 medicines. Kmart, I think, has a bunch of $4 medicines. There's a bunch. Bilo has a bunch. Like, anything that you can get for free at Publix, as far as antibiotics go, you can get for free at Bilo. I don't know if the blood pressure and the sugar medicine is free. So, which provides high-need Medicare beneficiaries with primary care at home, so that Medicare beneficiaries don't have to go to a long-term facility. They can get the care they need at home. Medicare value-based purchasing, which is part of that quality pay initiative, and reduction of Medicare payments for hospital readmission. So if you are readmitted to the hospital within 30 days, I think, Medicare isn't going to pay as much as they would have. So hospitals are really pushing to not have your readmissions. So these are the different types of ACOs that you have. You have an integrated delivery system, you have a multi-specialty group practice, physician hospital organization, independent practice association, and virtual physician organizations. And it just explains what each type is. With your integrated delivery system, Kaiser Permanente, which is where I got my 2 YouTube videos from, is an example, but it contains joint ownership of hospitals and physician practices. And there's some examples on the next frame of what ACOs are. Creation of independence at home demonstration, so which provides high-need Medicare beneficiaries with primary care at home, so that Medicare, and sometimes they own insurance plans. Your multi-specialty group practices, they have a strong relationship with the hospital or own a hospital. Your example there. So, you also, let's see, you can't charge people more based on the fact that they're a woman. The only thing that you can base your premiums on is age, geography, your family composition, and your smoking status. So, because women used to have to pay more for health insurance as opposed to men. They don't do that anymore.
Why do y'all think that? What do you think the rationale is? Pregnancy, yes, mammograms, all these things that we needed to keep us healthy cost money.
This year, 2014, there's no annual limits. Also, this year we'll have essential health benefits, and what that means, there's 10 categories of essential health benefits. I wrote them down if you guys care to hear them. Ambulatory care, emergency services, hospitalization, maternity and newborn, mental health and substance abuse, prescription drugs, rehabilitation, lab service, preventative chronic disease, and then for pediatric, you have to have a pediatric group, and within the pediatric group, you include dental and vision. I don't know why dental and vision is a separate thing, why healthcare doesn't seem to think you need to cover that, but if you're an adult, you don't, that's not mandatory, that you don't have to have it.
This is the year that the mandate
Cleveland Clinic.
for the employers.
Yeah, no, well, they delayed it.
They delayed it.
They delayed it. As right there. The employers, if you had 100 or more employees, the mandate, you were supposed to have a mandate this year, but they delayed it to 2015. And then you have, if you have 50 to 99, that's been delayed to 2016.
That's coverage for those employees.
Yeah. And also, this year we started getting wellness programs, which at MN Health, we've had a wellness program for a few years. If you're part of the wellness, then your insurance is like $30 or $40 less, I don't know. Like, I think I pay $180 for my family as opposed to $220 every 2 weeks. For Medicare, Medicaid specific, you have your expansion, which was to be every state, but now your states have the option to expand. So like this state we didn't expand, but I think in like California they expanded, and New Jersey they expanded.
Rhode Island.
Of Medicare payments to hospitals. Earlier when I said it was Medicaid, because I was confused when I read this at first, but I realized that this is Medicare and the other one was Medicaid. So if you have Medicaid, your hospital is not being reimbursed for HAIs. With Medicare, it's just being reduced. So here's another video. And this is just more specific about the act, okay? All right, so there's another article that I would like you guys to look at. It's called Healthcare Reform and Nurses, Challenges and Opportunities. It's a very informative article, I think. Most of it read? You don't have to read the last page or two. I think it's just about, like this, the graph. Don't have to read that part. Did y'all get most of it read? So what are some challenges that are facing healthcare based on this article? Facing challenges in healthcare reform.
Lack of general practitioners.
Okay.
The misinformation that's being like fed around the hospital systems.
Very good, yeah. They're also worried about increasing staff for the increase in population that is going to be covered, and also concerns about cutting costs at the nursing level. Afraid that they won't have enough nursing staff. But those are just a couple of challenges, and the article talks about all the different opportunities that there are for nurses. Primary care expansion, the increased funding for nurse-managed clinics, prevention and wellness programs, increased loan amount for nurse education. If you can actually get reimbursed for 2 years of teaching in an accredited program if you're a nurse educator. Increase the amount of loan repayments, and there's a ton more. So how can nurses be innovators and leaders? Well, the nurse-managed clinics and the transitional care model is one way. And I have a video that speaks about the transitional care model. Engaging in research, redesigning nursing education, expanding our scope for nurse practitioners and nurses, diversifying the healthcare workforce, embracing technology, not being scared of technology, promoting interprofessional collaboration. You know, doctors think that doctors are doctors and nurses are nurses. No, there's plenty of people on the healthcare team, and we all need to be taking care of the patient and not worried about where our levels. We need to, we're bachelor prepared nurses. Don't need to think that, doctors don't need to think that. Nurses need to grow leadership at all levels of nursing education. This is a leadership class, obviously, so we talk about leadership in this class and how we as nurses can promote that. And of course, be an active participant. Now this video right here that I want to show you guys is about the transitional care model, which I didn't know very much about. So I was very happy to find this video because it talks about what the transitional care model is. All right. So the next frame that I have here is just about primary care, because Ms. Webster said that you guys didn't really know what the difference between primary and acute care is. So primary care, the Affordable Care Act, of course, is all about primary care, and it's just care that is delivered with patient and community first. It's the point of first contact with that care. You work with patients when they're well, when they're sick. You know, you go to your doctor, which is not necessarily a doctor, it could be a practitioner, but that's your primary care person. That's who does, they will do all of your care, and if you need specialized care, they will send you to a cardiologist or a neurosurgeon or a gastroenterologist, and that's more a subspecialty. And then the last frame is Institute of Medicine recommendations. It has 8 recommendations the Institute of Medicine does. They recommend that we remove scope of practice barriers, which nurse practitioners and nurses have scope of practice barriers, to practice to the full extent of their education. Expand opportunities for nurses to lead and diffuse collaborative improvement efforts. Implement nurse residency programs, so hospitals across the nation have a nurse residency program which will help with retention of nurses. Increase percentage of bachelor prepared nurses to 80% by 2020. Double the number of nurses with a doctorate by 2020. Guarantee nurses engage in lifelong learning. Prepare and enable nurses to lead change to advance health, and create an infrastructure for the collection and analysis of interprofessional healthcare workforce data. Do you guys have any questions about that? Okay. So what I want to do now is I want you guys to be in groups, and at first I was thinking 5 groups because there's 5 plans, but we'll do 8. So each table will do a group or do a plan. There's a bronze plan, a silver plan, a gold plan, platinum, and catastrophic plan. So you're going to research these plans. Find information on the assigned one. How do you want
Platinum healthcare plan pays 90% of your overall healthcare cost, has the highest premiums and the lowest out-of-pocket costs.
Which one is this? Tell me.
Platinum.
Platinum. Oh, sorry.
The patient review, whoever pays the other 10% in the form of co-payments, co-insurance, and deductibles. So, who would want a platinum plan? If you expect to have a lot of healthcare visits or require regular prescriptions, or if you use your health insurance a lot, perhaps you have an expensive chronic condition, take a careful look at the platinum plan's out-of-pocket maximum, because that's kind of going to be like a deciding factor for that.
What is
Also,
the out-of-pocket maximum?
like, because it's with the 10%, like if you are visiting the doctor a lot, it's like what is like your max that you can pay out of pocket?
10%.
Yeah. So 90% is healthcare, like they pay, and 10% you pay with platinum. Also found a little word, the actuarial, how do you say that? Actuarial value. That's kind of how they're measuring the different plans.
Yeah.
So it's like tells you what percentage of covered healthcare expenses a plan is.
And then you don't have any like deductibles or like your co-pays are like $20 or less. Your prescriptions are like $5 to $15. So that would be for that.
So that's less than.
You might have said this and I missed it, but the till 26, like we can still work full time.
Yes.
Even if our hospital offers it to us, we do not have to.
You do not have to.
Okay.
That's
great.
Did nobody have gold?
Okay. They said that the health plan pays 80%, you pay about 20%. And they say if you expect a lot of like doctor visits or you need regular prescriptions, that this is a plan that you might want to look into because they have a higher monthly payment, but you pay is because they have more, they have higher
paying their doctor visits, and so they get more money for like the plan pays for more things, so it helps them out when they need more prescriptions and doctor visits.
I found the answer to the whole
Yeah.
marriage thing.
I looked it up too.
Yeah, if you are, yeah, if you can still be on it if you're married, if you're anything, not financially dependent on your parents.
Oh, okay.
And you can be an independent or whatever it's called. To go
Yeah.
Silver?
Okay, let's silver. If you notice, we've gone from platinum to gold, now we've got silver. There'll be some differences here.
So the silver plan covers 70%. So it's for people who don't have chronic health problems but still on coverage. And then it's about 280.
Bronze?
It pays 60% on average, and the policyholder pays 40%. It's good for people who don't use regular medical services and don't take a lot of prescriptions. It has the level of
That's getting jobs out of graduation.
You guys have quiz questions? I would like you to do a post quiz now, just to see if you learned anything. I hope you did. And if you'll just put post on the Scantron for me, so I know which one's free and which one's post. And you can leave it in the center of your table when you're done. Just put it face down. Oh, they're on.
Do you want us to leave everything like
Just the critique and your questions on. Everything else is yours.
So wait, we're taking
If you want, otherwise you throw it away. My feelings won't be hurt. The trees might be, but mine aren't.